I'd like to call the April meeting of the Health Committee to order. In the previous business, can I get a motion to approve the previous meeting minutes by Gary, second by Art, all in favor? Any opposed? Unanimous. Number 1, local law number A for 2017, local law of the County of Albany, New York, prohibiting the use of cigarettes, tobacco products, liquid nicotine, or electronic cigarettes in parks or recreational areas owned and operated by Albany County.
Paul is here.
Is Paul here?
Yeah.
Yep.
Paul.
Come on up, Paul. Are there any questions for the sponsor?
I do, Mr. Chairman. Welcome, Legislator Miller, it's good to see you. This just, I can see where somebody would be upset when somebody's blowing smoke in their face sitting there on a park bench. But is chewing tobacco part of the tobacco products here?
Yes, it is.
Would somebody chewing tobacco, how would that impose on anyone else?
Because a lot of the people who chew tobacco spit it out on the ground, and we have wildlife at the parks. I mean, Aley Pond has a lot of geese there that could ingest the tobacco, and it's not any better for them than it is for people.
But wouldn't spitting it out be the violation rather than chewing it?
Well, yeah, but it's also
Yeah, no.
to keep the youth from, getting a bad example too. That's the other part of it. Keep kids from starting to chew tobacco. I mean, they see enough of it on, going around without having it in the parks in front of them. So that's the thought behind it.
Okay, thanks.
Motion to move it.
Any other questions? We have a motion moved by Gary, second by
I'll second it.
Mr. Drake, all in favor?
Aye.
Any opposed? None opposed, unanimous. Thank you.
Thank you, sir.
In our current business, authorizing an intermunicipal data sharing agreement and memorandum of understanding with the Central New York Health Home Network and New York State Department of Health Office of Insurance Programs to provide behavioral health services to aging out youth. Mr. Giordano?
Good evening. Yeah, that's a mouthful of,
Yeah.
so the New York State Department of Health and the New York State Office of Mental Health, they've moved to a health home model for children in 2017. We've already seen this in the adult side of things for the last couple of years. Central New York Health Home Network is going to be serving youth and families in Albany County, and as part of their agreement with the state, they have to create relationships with local adult mental health providers for 2 reasons. One is to treat aging out youth who are no longer eligible for child and adolescent services, and to be able to treat their families if they're identified as needing such. So there's no money involved in this. This is simply an MOU with Central New York Health Home Network and a data sharing agreement with Central New York, my department, and the New York State Department of Health Insurance Programs to allow us to share information if we were to treat any of the patients they might refer to.
Motion moved.
Motion by Gary, second.
Second that.
Mr. Drake, all in favor?
Aye.
Any opposed? Unanimous. Number 3, authorizing a data use agreement with the Research Foundation of the City of New York for the Frequent Utilizer Project.
So this is coming out of the City University of New York, their Institute for State and Local Governance. Albany County has been selected as one of 15 jurisdictions around the country for study, and they're calling this the Frequent Utilizer Project. They're trying to identify profiles for people who are recidivistic in the criminal justice system, who also have high levels of behavioral health, social service, and health needs. What's going to happen, as I understand it, is that the jail census list, which is public information, will be matched with data that we have for our high utilizers to match and see if we could develop a profile. Similarly, they're doing this with DSS, I'm told, and other programs in the county. So at the end of the day, we would be opening up our data to them, but it would be anonymized and no personally identifying information would be revealed. It would be for purposes of a national research study to try to address this particular type of individual who frequently utilizes expensive behavioral health and criminal justice services. So we would be part of their research study.
Thank you, Doctor. Terry?
How did Albany County get picked for this?
So what I'm told is that the lead project in the city of Albany got the attention of the White House. And this is a federal research grant that came back down through to CUNY, City University of New York, and they approached us as one jurisdiction that was doing some innovative work with this population already, and they're doing some urban areas, some rural areas.
And these guys are just collecting data.
Correct.
That's all they're doing.
Correct. Their goal is to recommend to their funder, which is a federal agency, what this profile looks like and whether there's ways to intervene in these folks' lives.
They got a grant from the federal government to do it.
They already did, yes.
Yeah, that's what I'm saying.
Yes.
Make a motion.
Motion by Gill, second.
Second.
Simpson, all in favor?
Aye.
Any opposed? Unanimous.
Thank you, Mr. Chairman.
Thank you, Doctor.
Thank you.
Yep.
Number 4, amending the 2017 Health Department budget, overtime. Dr. Rowan?
Good evening. So we are respectfully requesting reallocation of $22,000 from the fees for service to overtime. This is in conjunction with efforts that we have at the local health department around public health accreditation, which has required a significant amount of extra work on behalf of staff because we have key staff that were working on this with a very short timeline that had left employment in the county health department. It also helps fund overtime for initiatives like last night. We had a large-scale mumps vaccination clinic at the State University of New York at Albany, where there's currently an outbreak.
No.
I got it in college.
Any questions?
Make a motion.
Motion by Gill, second. Mr. Simpson, all in favor?
Aye.
Any opposed? Unanimous. Number 5, authorizing an agreement with the New York State Department of Health regarding a rabies control program. Perfect timing.
Right, that's right. So this is a recurrent grant that we get from the State Health Department for which we had budgeted $47,234, but the award is for $49,072. And again, this is for services for mandatory human rabies treatment, preparation and shipment of animal specimens, pet vaccination clinics, and education and prevention activities.
Make a motion.
Second that.
Motion by Gill, second by Mr. Drake, all in favor?
Aye.
Any opposed? Unanimous. Number 6, authorizing an agreement with the City of Albany under the Local Impact, Local Initiatives for Multi-Sector Public Health Action Grant to implement transportation and community plans that promote physical activity.
So the next 3 RLAs are for the City of Albany, Waterville, and Cohoes to receive funds through our local impact grant. And this is a grant that a highly competitive grant that we were awarded from New York State, which aims to implement intensive location-specific strategies in community and health system setting to prevent obesity and diabetes, prevent diabetes, heart disease and stroke, and focus on reducing health disparities among adults. We were contractually obligated through the grant to work with these areas, and so that's why they were identified.
$5,000, that's what it is?
Any
Make the
other
motion.
questions?
Yes, Mr. Chairman, yeah. One of the ongoing concerns I have is, in health and social services, is practical outcomes, because in here I see a lot about facilitating meetings and developing signage, but the goal here is what? Is to get more people walking?
Yes.
Is there a way we
Well,
can?
that's one of the goals.
Well,
Certainly
in other words, I want to,
physical
instead of
activity.
having meetings and signs and stuff, I want to measure what the actual goal is, and that is more physical activity. Do any of these grants measure physical activity and how it's been changed?
Well, what the grants do is try to implement the complete streets policies, which, Albany has done a lot of work in developing, and the other municipalities have expressed interests, so that they can have walkable environments and to aim to guide the public towards where there are safe spaces to walk, exercise, and be outside. So I think those kind of improvements are measurable. In terms of the health effects,
When you say those improvements are measurable, the things that we're trying may be measurable, but the impact that they're having, we really, it's unclear to me what the actual impact is. That is to say, enhancing physical activity. Isn't it? We're not really measuring the increase or no increase in the physical activity based on these activities.
Right, we're not measuring the increase in physical activity, but the outcomes here are really reduction in obesity and heart disease and diabetes, and those are things that we do monitor through our community health improvement plan on a regular basis and report out to the county.
But how do we know, there's 100 reasons
Yep.
that affect obesity. How do we know that these specific things are actually having an impact?
Well, it's definitely difficult to measure specific response via percentage due to a specific intervention, but we know that improving the availability of these types of activities and environments for people does result in increased use of them. So I think that, while you can't necessarily say, I'm going to put this in and get this response out, I think that from a design perspective and from a, public good perspective, it makes common sense.
This
Okay.
is just to
Yeah.
promote physical activity, not to measure it, correct?
No, it's not to measure
Yeah,
physical
it's just to
activity.
promote it, so it's.
Well, the point is, how well are we promoting it? And if the promotion doesn't lead to enhanced physical activity, then we're not doing such a good job on the promotion
You're
of
a
it.
marketing guy.
Yeah.
How far is $5,000 going to go?
Well, it's still, it's still
Your time.
taxpayer money.
I mean,
Yeah.
come on, it's not going
It's
to.
still taxpayer
4
money.
hours.
you know.
Is there any,
Well, I mean, let me say, Gary,
Should we
and I'm speaking to a bigger issue here, is how do we get practical outcomes? I understand, it's not the most,
You're talking sidewalks, improvements,
What'd you say,
all
Pat?
physical activity.
All three.
How many
Yeah, all
six
three.
hours?
It's all the same thing.
so that's what I mean, is it really having an impact? And that's what I want
That was the
to, again, raise that awareness that
No, I see.
it isn't enough to do things we think are helping. We really need to do things that we know have a result.
Okay, we have a motion by Gil to accept number 6, 7, and 8, because they're all related, correct, Doctor?
Correct, they are.
So, can I get a second on the motion?
Second.
Second by Mert. A motion to approve?
I'll note something kind of funny, that we're looking to increase physical activity by the installation of benches.
Yeah, that's pretty good. You get arrested if you
Just
walk.
throwing that out there.
Hopefully they'll be walking enough that they'll have to sit down.
That's right.
Can I get a motion to approve 6, 7, and 8?
Hey, I'm
Jerry,
okay
second
with
by?
you too, like that.
Mr. Simpson, all in favor? Any
We'll be down
opposed?
that?
Unanimous. Thank you, Doctor.
Thank you very much.
Could have gave us more money, $5,000.
Motion to adjourn?